Welcome to the 5th episode of the Royal Society of Medicine's Health Emergency of Climate Change series. This episode is focusing on the effect of climate change on gastrointestinal diseases. My name's Amy Lord and I'm a colorectal trainee in Wessex Deanery with a particular interest in climate change, and I'm also the trainee rep for the RSM's coloproctology section. The format of this webinar is going to be a talk from our two expert speakers, Dr. Lindsay Jacks and Professor Dame Parveen Kumar, and this will be then followed by a Q&A session. Please do submit any questions you have all the way through at any time during the presentations using the Q&A function. I'm also going to be joined by two other surgical trainees who will be running the Q&A function. Sujay Shah is currently based at the Royal Free Hospital and has an interest in the impact of dietary and lifestyle factors on the prevention and management of gastrointestinal disease. And Victoria Pena is a trainee in KSS Deanery and is also a member of the Royal College of Surgeons Council, where she was the co-founder of the Sustainability and Surgery Committee. The previous episodes in this series have focused on respiratory, cardiovascular and dermatological disease, and it's perhaps easier to see how these diseases are affected by climate change than it is for GI disease. It's relatively well known that some of the behaviours we've developed as a species, such as high levels of meat consumption, are not only detrimental to the environment, but also increase our chances of developing GI diseases such as colorectal cancer. The direct effects of climate change itself on GI disease is a slightly more complex topic, but I'm sure our two expert speakers will be able to enlighten us on this in the next hour. So I'm going to move on straight away to introducing our first speaker, Dr. Lindsay Jacks. Dr. Jacks is a UKRI Future Leaders Fellow and Chancellor's Fellow in the Global Academy of Agriculture and Food Security at the University of Edinburgh. Dr. Jacks' current research projects broadly focus on understanding the interplay between agriculture, nutrition and health, with a particular focus on non-communicable diseases. Prior to joining the University of Edinburgh, Dr. Jacks was an assistant professor of global health at Harvard University, where she established an international research team investigating global non-communicable diseases. Dr. Jacks has carried out a large amount of research in South Asia and is a visiting professor at the Public Health Foundation of India. Dr. Jacks, thank you so much for joining us today, and I'm very much looking forward to your talk.
Thank you so much. It's great to be here talking about this important topic, not only climate change, but of course, poor diets and unhealthy diets, which lead to risk factors such as obesity, which is now the leading cause of disease and death in the UK, having surpassed smoking a couple of years ago. And as pointed out in a previous lecture in the series, our poor diets account for about 1/3 of global greenhouse gas emissions, with the biggest contributors being red meat, as Amy just mentioned. But the good news, I think, is that there are clear win-wins out there for both our health and planetary health. And polls are showing that a majority of people in the UK are willing to consider changes in their diet in order to reduce their impact on climate change. So the readiness and that willingness to change is there. And I think that healthcare professionals can play a key role in helping citizens transition. When it comes to the impact of our diets on planetary health, it's not just greenhouse gas emissions. Our food systems are also the major cause of pollution of lakes, rivers, oceans, groundwater from synthetic fertilizer and pesticide use. And they're a major cause of species extinctions from land clearing for agriculture, plus the use of synthetic pesticides. If current rates of decline continue, in 50 years, we will only have half the number of insect species alive today. In 100 years, we won't have any left, which will have catastrophic consequences for our food production and food security, which relies on insects for pollination. So the pesticide use and biodiversity is also a really major outcome of our diets that relates to planetary health. And in fact, pesticide pollution also contributes to the greenhouse gas emissions. So an estimated 9% of total energy use in farming is actually from the production of pesticides. Finally, widespread monocropping is not helping. Not only does it reduce the biodiversity and thus the nutrient density of our diets, but it also reduces our food production system's resilience to pests, which I'll talk a bit about more later. We can't talk about our diets and planetary health without mentioning food waste. Around 20% of food in the UK is wasted, and the vast majority of this food waste is actually happening in households. So we really can't blame retailers or restaurants for this. In 2004, 60% of UK households reported throwing away a bag of salad or lettuce, a loaf of bread, and fruit in a typical week. And they also dumped milk and wine down the drain. And unfortunately, since 2004, the amount of food waste has not really declined significantly over time. So we still have so much work to do in this area. It's estimated that food waste alone costs an average family in the UK £700 a year. So you can imagine that that money could be used to, change dietary behaviors and purchase things like organic produce. And, the composting of this food waste, which is actually only a small proportion of it actually is composted, but that is not going to fix the problem because it's really at the production side that this food is having its biggest impact. It's using up valuable, limited resources. For example, the production of all of the food waste in the UK is estimated to require land about the size of Wales to produce. And I think it's important to keep in mind that it's not just like throwing out eggshells or banana peels or kind of these inedible portions of food. It's, edible, safe, nutritious food that's being wasted. So I think we really can't solve the climate crisis if we don't tackle food waste. But going back to some of the things I mentioned previously, in addition to greenhouse gases, our food systems are contributing to pollution. Our world is now contaminated with pesticides. A recent study mapped agricultural land at risk of pollution, which is defined as having pesticide residues in the environment that exceeded the no effect concentration. And their main results are shown here on this map, with the darker red areas indicating agricultural land that's at high risk of pesticide pollution. And you can see that the whole world is lighting up in red. In Europe, in particular, 62% of agricultural land is at high risk of pesticide pollution. And this pesticide pollution is just not an inevitable outcome of food production and food security. With many parallels to AMR and COVID-19, we have created and we are responsible for the conditions that lead to pest outbreaks and the use of pesticides. For example, as I mentioned before, large-scale genetically uniform monocropping is prime territory for the proliferation of crop diseases and pests. And similar to what we saw or are still seeing with COVID-19, globalization means that pests are introduced and they quickly spread to new places. So for example, in agriculture, the fall armyworm is a major pest that the world is trying to tackle. And it's devastated crops all over the world, starting in Central and South America, but moving to Africa and Asia. And costing, the global economy billions of dollars a year in wasted crops with, significant impacts on food security and nutrition. And again, finally, similar to what we see with antibiotic resistance in AMR, stemming from overuse of antibiotics in humans and animals, we're seeing the development of pesticide resistance with the indiscriminate overuse of pesticides. And I think the thing that is really concerning about this is that we can produce more food organically. Recent modeling studies from France have shown that up to 60% of agricultural land could be converted into organic if we make some other changes, like reducing food waste or reducing our consumption of meat. And kind of redesigning livestock systems. So we can do this. It's just a matter of, I think, demand side drivers and government support to help farmers transition. And, when it comes to samples, exposure to pesticides in the UK, samples of about 3,000 foods and drinks that tend to be collected annually by DEFRA show that pesticide residues are actually quite common on food samples in the UK. So here I'm showing the proportion of samples that contain any one residue or more than one residue or above the maximum residue limit, which is the highest level of a pesticide residue that's legally tolerated in or on food. And while, it is noteworthy that the overall proportion of samples above that MRL is quite low, that MRL is not actually a toxicological parameter. So that was not set by toxicologists who have demonstrated that that level is safe for human consumption. It's actually the level of pesticides that would be expected on a product if farmers complied with good agricultural practices, meaning they applied the right amount of pesticides at the right time. And that's determined from really small scale farm studies in which the pesticide is applied to a specific crop. So, clearly a lot more research needs to be done in order to link up agricultural practices with downstream impacts on public health. And that's what a lot of my research recently has been doing. There are many health effects of exposure to pesticides. As clinicians, you might be used to quite rigorous multi-phase clinical trials for drugs. And it may surprise you that actually, less than 50% of the about 5,000 synthetic chemicals, some of which are pesticides, have actually undergone any testing for safety or toxicity, let alone, comprehensive testing for the many different impacts that they could have on human health. And you can see, as I'm summarizing here, that many pesticides are potent acetylcholinesterase inhibitors, particularly what we call organophosphorus pesticides. And these pesticides are designed to kill insects by inhibiting their acetylcholinesterase receptors. And in humans, this has been shown to have an impact on brain development in kids, particularly kids exposed to these during pregnancy, as well as neurological function. And many other pesticides are potent endocrine disrupting chemicals. So things like atrazine, which you may have heard of when it was first discovered to have impacts on the reproductive development of frogs, for example. And I've been quite interested in the impacts on obesity and diabetes. And meta-analyses have actually shown that individuals with the highest level of exposure to pesticides, the highest tertile of exposure, have a 58% higher risk of developing diabetes compared to those in the lowest tertile. And, that 58% is relative to, say, meta-analyses of sugary beverages, which estimate an effect of about 30%. So these impacts could be quite strong, but we just don't have, the clinical trial evidence or the feeding trial evidence that we have for other exposures that happen through food. And when we look at kind of other clues of potential impacts between pesticides and these outcomes, endocrine disrupting outcomes, several studies have looked at this, but one that I think is especially interesting is a study that looked at 24 different populations of mammals living in very controlled living conditions. So these are animals in, National Institutes of Health laboratories that have been around for many decades. And researchers actually looked at study records for those populations and the weight of those populations over time. So super controlled, fed chow diets that are standard over time, genetically uniform populations, but in every single one of those populations, they've seen an increase in body weight over time. So they're not changing their diet in terms of macronutrient composition, but there's some exposure that's happening that's leading to this weight gain. So there's some hypotheses that relate this weight, that suggest that this weight gain could be due to exposure to synthetic chemicals. So what can we do? Well, we know from some small, very brief feeding studies that if you eat an organic diet, you will see a reduction in your exposure to pesticides. So this was a small study done in the US of elementary school children who were fed 4 days of a conventional diet, 5 days of organic diet, and then back on a conventional diet. And you can see that there are substantial reductions in their urinary biomarkers that suggest substantial reductions in exposure to pesticides. And we also know that people who consume organic foods have a lower risk of diabetes. This is the findings from a cohort study in France of over 33,000 participants. that found that those who had the highest levels of intake of organic food had 35% lower risk of type 2 diabetes. And this is after adjustment for many confounders, physical activity, smoking, alcohol, kind of the standard things that you might think would associate with both organic food consumption and diabetes. Adjusting for all of those, they still found this very significant reduction in risk. So I think there are really in conclusion, 5 really simple steps that we can take to reduce our impact on the environment, mitigate climate change, and also improve our own health and population health. So the first is reducing food waste, which can result in significant cost savings that can be used to help support these other behaviors. Eating a plant-forward diet, and in particular, trying to eat plants that are locally grown and a diversity of plants, with diversity of fruits and vegetables. And then choosing organic when it's available and when it's affordable. And also, of course, eating fewer foods high in saturated fat, such as red meat products, salt, and sugar. So I'll close with one final promising slide, and that is a recent survey that was completed that looked at where are people in the UK with regards to changing their behaviors around some of those 5 simple steps I just mentioned. And you can see here the blue bars, which are people who are in the action or maintenance stage in terms of behavior change. People in the UK are tending to do a lot of these behaviors. This was a small survey, but it does show some promise that people are interested in this, or they're already at a stage of attempting to make these changes in their life. I think the one that didn't reach the 50% mark was choosing organic produce. So I think there is still quite a bit of room for improvement. But I think there is hope and that people, as you talk to them about making these changes, are ready to make them. So I will stop there with sharing a couple of resources on my screen and look forward to the discussion that we'll have today.
Thank you very much for that. That was fascinating. Certainly some shocking things that we probably didn't know about pesticides, but it's good to end on a positive note. So I'm going to move on to the next speaker. Our second speaker is Professor Dame Parveen Kumar. She's perhaps best known for co-founding and co-editing the Kumar and Clark textbook, which is a staple text for medical students and junior doctors worldwide. She is a gastroenterologist and Professor Emerita of Medicine and Education at Barts in the London School of Medicine. She's also Ambassador for the UK Health Alliance for Climate Change, Chair of the Board of Science for the BMA, and was previously President of the RSM, the BMA, the Royal Benevolent Fund, and the Medical Women's Federation. Her main interests are in small bowel disorders, global health, and climate change. Professor Kumar, thank you so much for joining us today. I'll hand over to you for your talk.
Amy, thank you very much for your very generous introduction, and thank you, RSM, for inviting me to talk about the effects of increasing temperature on waterborne and other gastrointestinal diseases. So climate change, as we know, has got 3 major problems in terms of the environmental determinants of health: clean air, safe drinking water, and sufficient food. And today we're really concentrating on the latter 2. And it's been predicted that between 2030 and 2050, there'll be 250,000 additional deaths per year due to malnutrition, lack of food production, malaria, which of course will increase, and diarrheal diseases. And you've heard Lindsay telling us about the food production and what's going on with the pesticides and so on. And really the food and water are intimately linked in causing problems. So the major problem is, of course, water and sanitation. And I thought before we talk about what might happen, let's just look at the dismal time we're having at the moment. Now, with the Millennium Development Goals on water, clean water, we did really fairly well. And it's now in our sustainable goals as goal 6 to have clean water and sanitation. But it's estimated that 3.6% of the total daily, that's disease-adjusted life years, global burden of disease, is due to water and sanitation problems. And 58% of this, and that's a fair bit of deaths, for 842,000 deaths per year, are attributed to lack of safe drinking water supply, sanitation and hygiene. 2.5 million human deaths occur annually due to diarrhea. And tragically, most of these are due to, in children less than 5 years of age, because they haven't had sufficient time and they're probably malnourished in any event. And the major deaths of this 2.5 are due to these children. And with what's going to happen, and we know for a fact that you get an increase in infection related to any precipitation event, which is water, floods, and so on. And we know that certain diseases are seasonal anyway. And this, of course, is a picture of all the flooding that happens, but this perhaps gives us a better view. And as you can see, as you flood the region, it's not difficult to understand how the systems of disposal and cleanliness will mix together. So there will be sewage being put into the water, and the systems will break down, and you actually get it having people sadly drinking polluted water. Now this slide, in fact, shows you rather like Lindsay's slide, but a different problem here. The climatic problems with increasing temperatures, and it's actually modeled on the changes in cereal grain yields to 2050. But as you can see, the climate gets hotter in the areas that are already in the lower and middle income countries. And if you look at the redness here, the percentage decrease of wheat production or any food production to minus 50 is shown in bright red, and the green is actually increasing. Now, for example, essentially what it means, the hotter you get, the less cereals you get produced. But if you take a country like India here, it is estimated that just a 1 degree rise in temperature will reduce the wheat output by 70 million. And that, of course, will lead to starvation, malnutrition, and all the other things. But on top of that, of course, you've got the other climate-related events, the floods, which I just shown you, the storms, the fire damage. We all know about the floods. We know that there are fires ranging in California, in Australia, in Siberia, which have been going for many years. Droughts, and there's been a severe drought in Ethiopia, which nobody talked about over the last few years. And of course, the climate-sensitive pests and infectious diseases are going to increase. And again, with rising levels of sea, you're going to get higher temperatures. So there's going to be an increased burden from waterborne diseases. The climate change increases the severity and frequency of rainfalls. And after severe precipitation events, we'll see again an increase in waterborne disorders. So it's just for a moment, I'd like to just pause a moment and look at the harmful effects that can happen with to safe drinking water. Now, first of all, the biological contaminants, which are microorganisms that thrive in the water, and these are bacteria, viruses, and protozoa, and I'll be talking about them in a minute. And Lindsay's already mentioned the chemical contaminants of pesticides, toxins, metals, industrial byproducts, all going into the water. We also have radiological contaminants, and these are atomically unstable chemical elements which emit harmful radiation, such as uranium, plutonium, and then the physical contaminants from rock and soil. But these are usually harmless and not a major problem because they're large particles. Now, the less talked about actor on the block really are microplastics. And microplastic contamination is really rife, and we've been gradually not seeing it because it is such a small size. So we're really talking about sizes of plastics which are less than 5 millimeters. And these can be either primary or secondary. Primary in that they're actually produced at that level, or secondary due to degradation of plastics wherever they may be. And in fact, they're of very variable shape and size. And you can see a sort of medley of them down here in that picture. And so the ocean is getting totally polluted. We've all seen pictures of endless plastic bottles floating around, and indeed even inside whales and big animals. But the sewage being put into the sea, as well as other stuff that is dumped. Now, all this is degraded down and broken down, but it'll take hundreds of years for plastics to actually degrade. And one of the things that I think we don't think about really in our homes is that microplastics come from clothes as well. So you can get microfilaments, microplastics in the laundry, and of course that'll be eventually flows out. It eventually flows out into the sea. And the suggestions are to use less water in the laundry and a lower temperature to try and prevent this happening, or at least decrease it happening. But whatever you say, there are 8 million tons per year, and this is obviously accumulative, year by year, of microplastics being produced in our natural habitats. And of course, they get ingested by fish and marine animals and enter the food chain. And they've seen that microplastics are in the muscles of, say, sea turtles. And of course, they will be in the flesh of sea and so on, and we'll be eating them. And the question then really is, what will happen to humans and how much disease will they get? And the answer is there's very little research that's been done so much, so that there are no good data to suggest that they'll be going. But one thinks that it might be perhaps respiratory or other smaller areas. It could be anywhere in the body that might be getting this into humans. So the major thing, of course, to try and get rid of this is prevention. So in other words, we shouldn't use plastic bottles. And if you do have plastic bottles, let's reuse them. Plastic bags, likewise. Laundry, I've talked about. Industry produces a lot, as do cosmetics. So there's many cosmetics that women use, maybe men perhaps even, have actually microplastics in them. In terms of getting rid of them, there's some research being done in Hong Kong, where it shows that they're using sticky bacteria to try and mop up these less than 5 millimeter particles, but that's still got a long way to go. So to try and work out what and how diseases get from water into humans, there's a very good classification produced by Sandy Kirkos some years ago, and he classified them into 4 groups here. The first one is waterborne, which is stuff that you just ingest, so cholera, enteric fevers, which is typhoid, of course, and hepatitis A. Or you can have water wash transmission, and really the more water you have, you reduce the amount of infection from the things like amoeba, trichomas, scabies. So if you had more water, you'd be able to get that reduced. Then there are other pathogens that are actually water-based, and they spend part of their life cycle in the host, which is, of course, then water-based. And that's things like guinea worms, schistosomiasis, and helminths. And the last one, perhaps probably the most important one, is the vector, because mosquitoes, black flies, the tsetse fly, all breed near water. So the sort of preventative strategies one might think of is obviously with the first one, improved drinking water and sanitation, which of course is throughout all these things that I'm talking about. For the water watch, increase the water quantity, but you need a reliable domestic supply, which often you don't get, particularly in villages. The further away the water supply for you is, the less reliable that people walk to it and get the water, therefore you get decreased quantities of water. Thirdly, it could be water-based, where the pathogen spends the life, and here, of course, avoid infected water, or if possible, control the vector populations. And the last one, the insect vector, again, surface water management, destroy the bleeding sites, and use insecticides, which of course you don't want to do because you're now polluting food. But certainly mosquito nets would be a viable possibility to try and reduce the malarial influx that we get. So why why is it the viruses have a greater change with climate change? And I put here just an example of dengue, which is a flavivirus, and that's transmitted by the Aedes aegypti mainly. There's another one as well, and they feed by the day. But they breed in still water. So anywhere where you've got water falling, there are little puddles, they will do that. But in urban areas, of course, it may well be in old rubber tires that are discarded and left. And when rain falls, it's a nice stagnant area. And the temperature rise has a very interesting thing to the breeding, the life cycle of a virus. You shorten the viral incubation, you shorten the breeding cycle, therefore you have more viruses, and therefore there's an increased frequency of mosquito feeding, because the mosquitoes will feed on there, and then you've got efficient transmission to humans. So the whole cycle is reduced, and therefore the incidence of mosquitoes transmitting dengue increases and onto humans. And malaria, which is often talked about, because even now over 1 million people die every year of malaria, and 500 million are infected every year. And of course, travelers get infected readily, really. And I think we forget that in the 19th century, malaria was endemic in England, in the marshes and the marshy areas. And it's a worry that it might come back again. And here's a picture of a village with stagnant water down there, an ideal place for a huge increase in malarial parasites, anopheles, with higher temperature and rainfalls and floods. And it's quite interesting that the border forces have screening for, at least they look out for any insects that might be coming in on luggages and on people as well. So today really is on gastroenteritis, and infectious gastroenteritis is incredibly common, and you can get vomiting, diarrhea, and abdominal pain. By and large, most of these are self-limiting to about 1 to 2 days, but they can cause a major problem in those 2 days. And usually we say, certainly in this country, if it goes on for 5, 6 days or a week, we ought to investigate them. And the pathogens that are all sensitive to climate changes, therefore will increase, are the ones below there. And I'm just going to go through them and just point out 1 or 2 factors. So the waterborne viruses that cause GI and liver disease are here along the top. And you'll all remember the name norovirus, which of course is the vomiting disease, which you get in cruises, in crowded enclosed areas with a lot of people. It's a ghastly thing to have, and people have retching, may take a day or so to develop, and then a couple of days before it disappears. Both hepatitis A and E are spread by water and are fecal oral, and in fact, luckily both of these do not go on to chronic liver disease, but they cause jaundice. And by and large, it's not a bad infection. They get jaundice for a few days and it goes away. But occasionally you can get fulminant hepatitis, which will kill you. And indeed, with hepatitis E, it has a mortality, particularly in pregnant women, which is something like 20%. Then just really for completeness, the other diseases we talked about, dengue and malaria, polio, which is a neurological thing, intestinal feces, and these are mainly respiratory and also gout. So going on to bacteria that cause gastroenteritis, all these here do. Campylobacter, watery diarrhea, and these 3 here, E. coli, salmonella, and dysentery, and Shigella, all cause dysentery, which of course means blood in the stools. And in fact, occasionally with Campylobacter, you can also get a dysenteric event. And I'll talk about these 2, but just to say that the worst one to get really is E. coli, 0518, and in fact there's 3 different bad types which can cause a lot of problems. But it's probably the commonest cause of travelers' diarrhea, people traveling from this country going abroad. And not a nice one to have. And the others would be included with the 2 below. So this, without even telling you what it is cholera. And that comes with contaminated food or water. You can get cholera, which can be endemic, but in fact, you get epidemics of cholera. And annually it causes a lot of problems because there's up to 4 million cases a year with many, many deaths. And the problem with cholera, as we all know, is that it's torrential diarrhea. And the problem is not the Vibrio cholera, but it's actually the dehydration. And on the right, you can see the cholera beds. There's a hole here for your bottom, and there's a bucket at the bottom to just collect the effluent, which is almost like a tap. If you've ever seen this, it's quite alarming coming down. And you can see you replace the fluid there. There are 4 bags going into that person there, and you put in salt, water, chloride, and all the elements that you want to do. So it's a condition that kills you by dehydration. And there are 2 here mentioned here. This is the one that is around the world, and this one is still luckily in the Far East and in Asia. And again, the high climatic temperatures will lead to faster bacterial replication, particularly with low precipitation. And there is a global roadmap for cholera to 2030, and the target is to reduce cholera deaths by 90%. It's going to be difficult to achieve if the temperatures rise. And parasites are the other major problem. These 3 at the top give you GI problems. This can actually give you both GI and other problems. And this one, just for completeness, I put in because it's a water gastrointestinal tract life cycle, but it's really a skin problem. So giardiasis and amoebiasis I'll talk about. Bilharzia is again fresh water, and it's due to snails. And remember, depending on which sort you get, you either get the gastro or the urinary tract infection. I don't know whether you've noticed, but I've certainly noticed that when you walk around in stagnant lakes and ponds, you're now seeing this green algae developing. And this is Desmodesmus, which is an algae, which is chlorophyll algae, which does have problems with humans. It's meant to be poisonous, and it certainly causes a lot of itching problems as well. So the parasites, talked about amoeba, amoebiasis, again, many deaths per year, again, poor sanitation. And again, the problem with the amoeba is that it exists in the soil as cysts, which then can last a few months. Again, a fecal oral route, and again, contaminated water. So really to get rid of all these, we really need decent water. And amoebiasis not only affects the gut, but it can give you liver abscesses and liver disease. The prophylaxis was really good sanitation. And it's difficult to see how we can get good sanitation, particularly in humanitarian crises, such as in migrants and refugees crossing borders. And giardiasis, many of you may well have had it. It's fairly common. Again, contaminated water and food, and you get watery diarrhea, cramps, and weight loss, as with the others. Now, one of the things that perhaps is difficult to understand is how droughts can precipitate waterborne diseases. And this is a rather good cartoon, which sort of shows that in some is defecating here, but the soil is very, very dry. It's got cracks in it, and therefore the bacteria will go across, and the pathogens will go across here to the bottom of a well where somebody is taking out the water to take down to the village. So what can we do? Well, we can try filtration in terms of removing larger particles and sediments, and filtration will just do that, but that's not the problem really. It'll not take away viruses or a few heavy metals, but it's quick and it doesn't alter the taste very much. Chlorine, which we talked about before, will remove all these, including killing viruses, which is good, but you need to leave the chlorine in the water for a while before it'll act, but it won't have any effect on Cryptosporidium. So really it does change the water. And of course, chlorine, as you know, is in all swimming pools, and swimming pool water is not good to drink, either for taste or for bugs. Again, water purification tablets, leave at least 45 minutes, and UV lights again, can again, good for getting rid of some of these, particularly norovirus. So I just thought I would mention this because our medical students are very aware of the global health and global problems. And this actually had its genesis in the bar of the RSM. We were having some coffee with the students who were really lively to talk about global health. And we thought we would all write a book, and we wrote it with, and in fact, I edited it with B. Sethi, who's also president of the RSM. And we wrote it with 127 medical students from around the world, each of them giving a little vignette of what they'd done and how they'd managed to sort out a problem in global health. And water was high on that list. So just to summarize then, waterborne diseases will increase in a hotter climate, as we've just seen. It'll have a significant impact on diseases, on life of people, on their livelihoods, and also on the local economy as well as the international economy because of loss of manpower. Again, this will have a huge financial burden, and one of the commonest causes of becoming bankrupt for these families is that you could use 10% monthly of a family income per person in the person per family for the person who's infected. And this is really for medical treatment. They might need to travel if they can't do it by foot, to require transport to get to the nearest hospital. They require special foods, and of course, a loss of manpower and the earner in the family means that the family doesn't survive so well. So there are major socio-economic impacts for waterborne infections, and really we need to put some measures in place to improve the current trends, as with climate change, this is only going to get worse. So thank you very much, Amy.
Thank you very much for that fascinating talk. Again, some shocking things, and obviously the impact of climate change on global health is a huge issue for the future. I can see that we're already getting loads of questions coming through on the Q&A. So at this point, I'd like to hand over to Sujay and Victoria, who are going to chair the Q&A section and hopefully get through as many of your questions as we can.
Thank you so much for both quite fantastic and informative presentations. There were a lot of points raised that a lot of people may not give a second thought to normally, and I think these talks will have an important effect, at least of getting people to question their dietary and lifestyle choices. There are a few things from myself that I know will be changing in my daily kind of home and work lives. A couple of questions from that echo some of the stuff that's coming through the chat, but also for myself. Lindsay, I was quite enthused by your last slide, and it's very nice to show that we are kind of leading the way in a lot of the issues and talking from personal experience, talking to friends and colleagues. There is certainly an awareness and an enthusiasm to change. It may be a very simple question, but what is a plant-forward diet? We talk a lot about plant-based diets, but what's a plant-forward diet?
Yeah, so I think we have started to use the terminology plant forward instead of plant-based to kind of rethink the way that you think about meals, and not to be more inclusive to people who do want to consume some animal source products. Just so it's kind of when you sit down to plan your meals for a week, often, and maybe this is just an American, so this is kind of how I was raised, but the meal planning for the week often started with the meat. So we're having fish this day, and then the meal is planned around the fish, or we're going to have pork tenderloin tonight, and then the meal is planned around, that. And so instead, a plant-forward diet would start with, all right, we're going to have, barley tonight, and what kind of things, what can we plan around that? So it's starting, ideally with a coarse whole grain, and then planning around that. And then you can add in some animal source products. So if you're having, barley, a grain bowl or something with, a whole grain and kale and tomatoes or whatever, you can have a little bit of cheese on it. So it's not starting with the animal product as the centerfold, but starting with a plant product and then building around that. I think a plant-based diet, people tend to think of vegan, vegetarian, and they're kind of exclusionary. So plant forward is just a little bit more inclusive, a little bit more trying to rethink the way that we plan for our meals in households throughout the week.
Absolutely, thank you very much. Prof. Kumar, I've got a question for you as well. I mean, living in the UK for the last 20 years or so, it's almost, it's very easy to kind of forget a lot of the stuff that goes on in the developing world, certainly related to water and clean, and access to clean water. Certainly when I grew up, that was a big issue. Just as a healthcare professional in the healthcare setting, one of the things that, certainly more recently than I've become more aware of, is that there is a lot of single-use equipment that we come across in the healthcare setting. Are there any kind of starting solutions in the healthcare setting or in the hospital setting that you would say to a junior doctor, kind of trying to look to reduce this on a day-to-day basis?
Are you talking about in this country, or are you talking about in other low-income countries?
In this country, kind of on a day-to-day basis for all of us to take back to our working.
Right. Well, I think the first thing you can do is to stop using so much water. I think we really use a lot of water, and that's not going to be forever for us to be in high supply. So I think that the measures like that, luckily, we're so lucky we have clean water. But if I could just take you back to the sort of low income groups, where to get water, we really want clean water, reliable source, not too far away from a village or wherever you are, and to be able to be brought back. And the other problem, of course, is crowding of water sources. So if a water source is far away, it's less likely that they will go and get more water because it takes. I think that they worked out something like 200 million hours a day are spent by women and girls going out to get water. So I think it's a totally different situation there. And I think in the Western world, of course, we're lucky to have the water board producing water from the taps, but we must use that sparingly.
Sensibly. Thank you.
And sensibly, yeah. And the other thing, just if I may, for example, we talk about washing hands between patients or using the gel. Now, in fact, I remember in Zambia, I was in a biggish hospital, and to try and I wanted to wash my hands between patients, and there was a whole series of sinks with water. I went down the whole row, and nothing came out of the water at all. So there was actually no water. So what do you do?
It's a lot of things we take for granted.
Yeah.
Victoria?
Well, thank you, both of you, for a great presentation. I can answer Sujay's question myself for you. One of the best things we can do, just very briefly, as doctors in hospitals to try and reduce our carbon footprint is to not use single-use items where possible. Something like using washable drapes, washable gowns that we use, use your scrub cap. This is in surgery, but this actually applies, in A&E and other areas. So just as a very quick answer to that would have a huge impact on the NHS's carbon footprint. My question to both of you, if that's okay, is quite a big question. It would be, what would you like to see happen at COP26 later on in the year that would really help? Or what would you just like to see happen? And then firstly, I'd like to go to Dr. Jacks. Thanks.
So I think that there will be a lot of discussions around sustainable farming, and luckily a lot of voices from the global south, where there's been a lot more progress on transitioning to more sustainable farming practices. And so I hope that will kind of nudge people around the world to realize that the current system is not fit for purpose anymore, and that we're facing different challenges now. We can feed the world with the food that's currently produced. We're just wasting a lot of it. And we can definitely afford to transition to more sustainable approaches without any adverse effects on food security. Food insecurity is really a political issue now, more so than a production issue in a lot of places. And so I think that, my hope is that there will be great examples from partners all over the world on how to produce food more sustainably, and that lessons will kind of be translated to other places like the US, where we see a little bit less progress. One of my partners, I have a large cluster randomized controlled trial in South India that's going on, where we're working with the government who's transitioning an entire state to organic agriculture or natural farming, which is kind of a bit broader than organics. And, you know, we're trying to understand what the health benefits of that are. And he'll be there and talking about how they managed to get this passed politically and what it looks like on the ground, and kind of providing some inspiration for similar transitions elsewhere. The EU has only set a target of 25% organic agriculture by 2030, which is actually would be a tripling of current land under organic. So a lot of progress still needs to be made, but you know, progress is being made elsewhere and lots of lessons to learn. So I hope that that will happen at COP26.
And Prof. Kumar?
No, thank you. I entirely agree. I think sustainability is the name of the game, whether it be for food or water. But I think that those are the two major things that cause ill health across the world. I would like all the governments to engage and put all their thoughts and money into it. I don't think we've got enough money to actually to do these things. And I think with the reduction of the 0.7% GDP that they were giving for low and middle income countries and for health abroad has gone down to 0.5. And I think that's caused a major problem and loss of money. For example, THET now hasn't got the money to do these exchanges, which are helping sustainability. So, and also what I'd like is that we make a big song and dance about COP26, so that every single one of us actually takes home the message that we've got to use less heat, less water, and somehow, as you say, single-use things, you know, try and reuse them, get rid of the plastics, which is a major problem, and we still don't know that the health problems that may ensue in many years later. So I agree, sustainability, I think, is the name of the game.
Thank you. Just before I hand back over to Sujay, there's one question that's just come through that actually could be applied to both of our speakers today. So should the NHS be taking much more of a public lead in actively demonstrating the importance, and I'm going to say the NHS, I'm also going to say the Royal Colleges, and I'm going to include the government, but from the medical side, much more of a public lead in actively demonstrating the important connections between our food and our health and society? Should all of our hospitals be required to serve only food that does not damage our climate, our environment, or the health of future generations? And maybe not just the NHS, also this could apply to other public institutions. Like, I've just enrolled my children in school and asked what kind of menu they want, and actually, you know, your Dame, I'm vegan, and if I asked, they didn't even have vegan as an option. So you know, it's not just the NHS, it's other public sectors. But what do you think about that could apply to both of you, if that's okay? Dr. Jacks?
Yeah, I think so. I mean, it's kind of like the smoking example, which I'm less familiar with here, but in the US, when hospitals banned smoking and doctors weren't allowed to smoke in hospitals anymore, that really set the example and kind of set the bar for what then went on to be passed to all public places, restaurants, everywhere. You can't smoke inside anymore. And so I think that if the healthcare sector was leading the way and saying we're not going to serve processed meat, no more pepperoni on pizza, then that's just a no-brainer. It's a clear win-win for, as you said at the very start, colorectal cancer and environmental impact. And until I think the healthcare sector does it, the public won't follow. Like I think that there's so much power in being a healthcare professional to set that example. So I guess my answer is a resounding yes, please, soon.
No, I entirely agree with that. The NHS is a massive mammoth industry, really, and I think if we don't take the lead, I don't see why people shouldn't, our patients and the population should. The question about whether all diets should be organic and meat-free for patients in hospitals, I think that's going to be difficult to past really patients, because patients will, everybody will complain. But if we can ourselves be the models that this is what we're doing and we're not eating meat and not throwing away things and so on. But if you think about it, the NHS has also got problems with pollution, because it actually takes up something like between 7 or 8% of the total pollution for the country, with transport and all the things we do. So I think it's a question of walking around, turning off the lights so you don't get a higher temperature. Diet and water, we've now got water sort of, those, what do they call, filters on every single tap, so we don't pass infection around. But I think we've got to do it by showing people that we are ourselves doing something positive. And as somebody said to me the other day, that anybody who goes on television or on things like this should, before they're allowed to say anything, say what they're doing to help climate change and pollution. Isn't that a good idea?
Great idea. CJ, do you have some more questions from the audience?
This is a question mainly primarily for Lindsay, and it's kind of a recurring theme. Organic food is significantly more expensive, and how does that fit with increasing health equity?
Yeah, it's a great question, and definitely one that I struggle with, also. And I think that the key here will be the cost of organic will go down as demand increases. I mean, organic right now is such a teeny part of, 2 to 5% of the retail market that it is kind of this higher priced item. But as you transition to a place like Denmark, where 5 times that is of the retail market is organic, the price goes down and it just becomes the norm, and it becomes much, much more affordable. And so I think that we will get there eventually. And I don't think that that means that we shouldn't try to make those transitions happen for people who can afford it now, in order to support that reduction in price overall for other consumers. So I think that it's definitely an issue now, but I don't think that it's an inevitable aspect of organic food production that it has to be that expensive. I also think, which we're working on here, with launching across the university planetary health meal plan this September as students are coming back. We've been talking a lot with local producers about how can we make organic food more affordable, particularly produce. And I think when I talk to students and I talk to people who are concerned about pesticides, but on a really tight budget, I often talk about, well, just try buying a couple of produce items organic to start with, the things that tend to be really high in pesticide residues. So leafy greens, start there, buy all your leafy greens organic, and then you can kind of integrate other things as they become affordable and accessible. So it's not a clear answer, I'm sorry, but hopefully a little bit of.
I think it's fantastically clear. The little that we can do as individuals, I think, as you said, will drive down, will increase demand, and hopefully overall drive down the issue of cost. So fantastic. Prof. Kumar, there's a question that's come through regarding distribution of malaria malaria in the UK in the past, and whether or not certain populations were more at risk. Can you tell us a little bit about the distribution in the past and whether that may well be reflected in going forward?
Yes, it was quite patchy actually in the 19th century, but before that, I think they first found malaria in the 16th century in this country. And I just wonder whether it's all related to temperature, because the malarial parasite it has a certain degrees that it doesn't like and does like. So below 20, it doesn't like, so it will not grow there, except for sporadically. But over 30, it finds it difficult to breed. So you've got a sort of a temperature level there. But of course, if you're all going to get hotter, we're going to get malaria back again. So I'm afraid I don't know where exactly, if you ask me where it was, but it was definitely in marshy areas, which would be suitable for the parasite to grow.
We've got a second. My last question just would be to Prof. Kumar you said about not reusing plastic bottles and not reusing plastic bags in your talk, which I understand because of the microplastics, but does that outweigh the benefits of the fact that you've used a plastic bag and then it just goes into recycling or landfill? That might be me misunderstanding.
No, I think it was probably me not being clear enough. No, I said, if you've got them, reuse them, but don't buy more. Okay, because you're just adding to the whole thing. So I see so many people buying it and throwing away and then buying another bottle, rather than, why not just fill it up from the tap, which is less, has less bugs in it than plastic bottle.
Absolutely.
And it's been shown scientifically very well.
One of the things COP26 could do is recommend the ban of plastic bottled water being sold. That would be a good start.
It's the range, really, yeah.
Rosie, do we need to hand back to you?
I think we probably do need to stop. Unfortunately, we've run out of time. I'm sorry to cut that Q&A session short. There are obviously loads of questions that haven't been answered, and hopefully this is going to continue to stimulate discussion with colleagues outside of this webinar. I think this has been an absolutely fascinating webinar personally, and I'd really like to thank the two panelists who have given us such great presentations. And also thank you to Sujay and Victoria for handling that Q&A session so well. Please do complete the feedback survey that you're going to be sent. We really do appreciate your feedback. There are CPD points available once you've completed this, but just as a reminder, this is only available if you're watching on Zoom and not on YouTube. We will be sending out the full resources and the link to the recording of this webinar in the follow-up email. I'd like to extend special thanks to Michael Rapp, who has supported these webinars and allowed free access to them. And finally, I just would like to also give a reminder that there is another episode coming up on the 25th of May at 6 p.m, which is about the unborn child and children's health, which I'm sure will also be really fascinating. Registration for that is going to be on the RSM website as usual. So that brings us to the end of this webinar. Thank you so much for everyone who's tuned in, everyone who's submitted questions, and I hope everyone has a great evening.